who had everything lined up, and then we changed the order. So our next one is we've got the Cancer Society presentation. So welcome, Cherry and Sally and team.
Here. Atmade, Talofalava, Malo, Lele, Chorana, Salam, Alaikum. Good morning, everybody. It's really great to be here. I want to begin by acknowledging Council because you provided the most fantastic venue of Lovelock Track for our Relay for Life event this very last weekend. And it was the biggest relay event we've ever had. We're particularly grateful to local board chair Harry Doig, who really championed our use of that track, and also particularly thankful to Meg Goff, who did a brilliant job of opening the event and welcoming our 1,300 people affected by cancer, impacted drastically by this disease, who were there to celebrate, remember loved ones who'd passed on, and to fight back against cancer and raise funding for Cancer Society. With regard to our kaupapa today, I want to congratulate Council. You have adopted a comprehensive smoke-free policy, and you have allocated $2 million for its implementation. This is fantastic. You've taken a strong stand for a smoke-free Auckland 2025. Cancer Society strongly supports the intent of the Maori and Pacific Action Plan. However, we have some concerns about the plan you're considering today, as well as the lack of progress with smoke-free implementation, as this is needed to provide a strong foundation for the targeted Maori and Pacific Action Plan. Since 2013, when the smoke-free policy was first adopted, there has been quite limited implementation. For example, signage and priority settings across Auckland is generally poor or non-existent. 2 summers have gone by since town centres, plazas and beaches became smoke-free. Yet in most places, signs are still not up. It's similar for events, and I know you are aware of the 660 concert at Western Springs. There was little signage, no smoke-free message on the ticket, and no enforcement at the venue. One event goer said, "Given the number of people smoking, I just assume you must be allowed to." Leases are being renewed without smoke-free clauses, contrary to your implementation plan. We know of a sports club lease in a Maori Pacific high priority area renewed for 33 years with no smoke-free clause. How can we expect the targeted actions highlighted in the Maori and Pacific Action Plan to work when Council hasn't adequately implemented its policy in sports clubs, town centres, bus shelters, leases, contracts and more? Stronger and coordinated implementation across all Council departments and CCOs is urgently needed to support the success of the Maori and Pacific targeted approach in high prevalence communities. A region-wide smoke-free public awareness campaign is also desperately needed, a campaign that resonates with Maori and Pacific communities. A 2016 Council survey found awareness of smoke-free was low, and between 2014 and 16 had decreased across all smoke-free settings. For example, only 15% of the public knew that all sports fields and outdoor events were smoke-free. Yet public awareness campaigns both increase awareness and result in higher compliance. As I've already stated, Cancer Society supports the intent of this targeted smoke-free Maori and Pacific Action Plan. However, we have concerns the current draft may not deliver on its intended outcomes. Furthermore, the Ministry of Health has allocated millions for Council, DHB and others to work with Auckland's priority communities to reduce smoking, along with obesity and alcohol harm. Council needs to ensure it does not duplicate existing services, but rather has a strong focus on its core business of implementing and promoting smoke-free places. If Oahe Kore Hapori Whānui focused more strongly on the 4 strands of the smoke-free implementation plan, as it indicated in this plan that it would, we believe this would support the targeted programs in those Māori and Pacific communities to get much greater traction. In our view, equal weight and equal budget needs to be allocated to the Māori and Pacific Action Plan and to Council's Smoke-Free Implementation Plan, because they support and complement each other. Cancer Society is particularly concerned about the promotion of vaping in the Māori and Pacific Plan, as outlined in Activity Stream 3, Switch to Quit, through vaping. While vaping is safer than smoking, it is not safe, and I think Stuart has highlighted that for us. While we strongly support vaping as one of the tools that cessation services offer their clients, we urge a cautionary approach to promotion of vaping at the community level. It is a delicate balance to promote vaping as a quit tool without promoting vaping to young people. Large longitudinal studies, that is very robust studies, in Canada, the US and Switzerland report young people who vape are up to 4 times more likely to smoke within 1 year of starting to vape. We ask Council to take a precautionary approach to protect Auckland's young people from starting to vape and smoke. Our youth smoking rates are so low, let's not risk a reversal of that. We also want to avoid inadvertently rolling out the red carpet for the tobacco industry, who are applying their marketing might to promote their vaping products, online and soon to be in our communities. So our recommendations to you today are to allocate the smoke-free budget 50-50 to the Māori Pacific Action Plan and the Smoke-Free Implementation Plan, to amend the Smoke-Free Pacific Action Plan to focus more on promoting smoke-free public places, to remove the focus on vaping and its promotion, and to adopt best practice community action principles in implementing the community initiatives. Like Stuart, we also want smoke-free places to be vape-free. And lastly, the smoke-free implementation budget, we implore that it includes one whole FTE to lead smoke-free implementation internally across all council and departments and CCOs. This is one of the key reasons we've seen such poor implementation to date. There's not been the capacity in the team working specifically on that. And lastly, to fund a region-wide public awareness campaign. Cancer Society believes all these are needed to achieve Council's goal of a smoke-free Auckland by 2025. Thank you.
Thank you. Right.
I'm here with my colleagues Terry Morgan and Le Tutufonga. I'm the Health Promotion Manager, but my team members are very informed about the tobacco and smoke-free areas. They'll answer questions.
Yeah, thank you. Thank you, Leitu and Cherry. Councillor Hills.
Thank you, and 100% support your work, but I am still a bit confused around the whole vaping, smoking. And the other concern I have is when we talk about changing over, we're mostly talking about American studies, which is completely different considering cigarettes are $5 or $6 a packet still in America, and they're $32 here. So I just worry that we're mixing things a little too much and making assumptions around, the change from vaping to smoking for young people, because it's so accessible. in the States compared to here and things like that. So I totally support your direction and your concerns, and generally supportive of all of them, but I do worry that we conflate studies around people who are trying to quit using vaping and then also use it the other way when the US is so different to us in a regulation space.
Madam Chair, can I just respond to that, Richard? Or Councillor Hill, sorry. You're right, the American context is quite different from the New Zealand context. However, the large longitudinal studies that Sally referred to are actually across 3 different countries. They were in America, Canada, and also Switzerland. And I think that what we can learn from the States is actually what's happened around the huge availability around vaping. At this stage, it's less than a year in New Zealand that we have had e-cigarettes legally available here. Up until like last year, 2018, they were considered illegal in New Zealand. So it's less than a year. And what I do want to say is, while the United States is quite a different context from here, they did introduce e-cigarettes, and I just have something here from the Food and Drug Administration, and they said that they hoped e-cigarettes would give adults a safer way to give nicotine while they tried to quit, and as such decided to allow companies to sell those products without first proving a net public health benefit. We set out on that at a time when youth use of these cigarettes was at epidemic levels. Now that we're seeing epidemic growth in the use of these products by kids, that changes the equation. So they've actually seen huge increase, and the tobacco industry is the most popular product in the States is the Juul product. It's high nicotine levels. We don't know whether that will actually come into New Zealand. At the moment, we have no regulations. The government is bringing in regulations later this year. So we still have a concern about youth uptake of vaping.
Can I also just add to this conversation around uptake of youth vaping? At our latest Relay for Life events, the conversations with young people, we had a series of questions, and it was around vaping and the effects and impact that it would have. Straight away, they would say, I know of many of my friends who are already vaping. Then I would ask the question, okay, so what is happening? Are they getting off the smokes? No, it's just a cool and trendy thing. And so I also live out south. I have a lot of family and talking to nieces and nephews, and they say the same thing. So that is a red flag to me as an auntie or as a local person, that there is potential for this risk. Hence why a Cancer Society starts around that.
Kia ora, thank you for your presentation. Just what's the percentage of, I'm trying to find the percentage of Maori and Pacific smokers in the Auckland region. Do you have those figures of what that is?
I don't have them exactly in front of me. They did reduce slightly in the last year. The latest figures from the Ministry of Health were released on Friday, just gone by, and both for Maori smoking and Pacific smoking came down. However,
my question is, out of the total cohort of smokers in the whole of the region, what percentage are Maori and Pacific people?
Just to make it easier, on attachment A, page 2, we've got the breakdown. Unfortunately, like all things, it's 2013 census, but it's on here.
40.
Yeah.
40%. Māori and Pacific smokers, we totally accept that Māori and Pacific people who are smoking are our highest rates of smoking. We are completely committed to reducing that inequality, and we want this to work.
Yeah, Sally, Cherry and Leitu, thank you very much for the work the Cancer Society does. I think you do a fantastic job and you're an important part of the solution to our problem. I just want to clarify, on vaping, you're saying it may be appropriate for cessation services to refer people who are already smoking to vaping and to use it as a tool, but it should not be promoted more widely as something that is safe and a substitute. And you're also warning us, I guess, that when tobacco companies start buying up vaping companies and start promoting the product, it's not for our own good. Basically, that's the message you're giving us on vaping, just to clarify that.
Yeah, we're just asking for council to take a really precautionary approach around this, that when you actually promote vaping to people who are wanting to quit or to smokers, there's a real fine line between actually protecting young people from hearing the same message, it's okay to vape.
Yep.
And that's what we want to prevent.
Okay, that's good.
Sorry, Mr. Mayor, that was your question answered. Just distracted for a sec. Councillor Barney.
Thank you, Madam Chair. Thank you for your presentation. I wanted to pick up in our report, it says that successful smoke-free approaches are about people, not just place. Yet you are advocating to us to spend half the budget on place through Auckland Council. Could you, because actually the whole approach of this is that it be community-led. So are you sure that that is what you're advocating to us to do?
Yes, because actually place is full of people as well. So if we just take, for example, the 660 event where the young child had an asthma attack and went to hospital because of smoking, that was 50,000 people within that place. So it was supposed to be smoke-free since 2013, that's 6 years ago. So what we're saying is smoke-free places, when people go there and experience them as smoke-free, it actually supports people to help them quit because they're not getting triggered by seeing others smoking around them. It protects us from secondhand smoke, and it's really important. It's a key strategy that's underpinned both national and local government strategies throughout Aotearoa. So we're actually saying smoke-free places are where actually people go and they need to be able to enjoy it. So we can't separate out place from people.
Thank you.
Councillor Casey.
Sally, you mentioned the 660 concert at Western Springs and the sad fate of the wee boy who was taken to hospital. After that event, I wrote to RFA to ask them about signage and tickets and so on. And I was just rereading the email, and there's one thing in there. And by the way, all the e-tickets that went out to customers did have "This is a smoke-free venue" on it. The signage is limited by the very nature of Western Springs and infrastructure and the concerts at night, so that's diminished anyway. But the one thing that Chris said in his email was that no stadium in New Zealand currently confiscates cigarettes. So there is an ability to search bags and confiscate alcohol, but not cigarettes or smoking paraphernalia, whatever that might be. Is it your view that that could be done? It's not done anywhere in New Zealand at the moment, he also said in his email. Is that something you'd like to see Auckland Council do at our event?
Just to say, we did contact the Regional Facilities Manager after the 660 concert. We had a great meeting with him and he acknowledged that they can do better. We talked about a whole range of strategies. In fact, actually the tickets that went out didn't have smoke-free promotion on it. We had to, when we went through it with him, you had to click through quite a few emails to then get to a point where it says Western Springs is smoke-free. We talked to him about really promoting the event as smoke-free, promoting it proudly as smoke-free. 50,000 people is a huge number to influence. What we did say to him is that they have a list of about 20 different items that are confiscated. What we said to them was, in the first stage, is why don't you, when you're doing the bag checks, when there are people there coming through and you see cigarettes, say to them individually, face to face, we want to make sure that you know this is smoke-free.
as one of the things. He said that they were open to looking at that at a later stage around confiscation. We weren't advocating for that at this stage, but we gave him a lot of different strategies and tips about what they could do. He's emailed us back since. He said he's put those into practice. Even though it's not huge big concerts with those numbers, they have had much more effective smoke-free and kept their venue smoke-free. They're doing that to practice now before their big music events later this year. That's an example, though, of why we're really advocating for a community activator to work across council departments and CCOs to really get all the events, all your sports clubs, all your leases, work with AT, CCOs to really embed smoke-free. And I think we would really see a success. Unless we do that, then communities are really going to struggle out there with community-led initiatives. There's not a basic groundwork and framework from Auckland Council's work. And so we think both are really important. Thanks.
Thank you. Just on the vaping in cars with young children, I know that the smoking, we've stopping smoking with young children, but some countries they have actually stopped the vaping where there's young children because the vaping is also it completely clouds the whole car, and it's not only being taken in, but it also you can't see out because of it. So would you like us to support the vaping of the car to be something else to be looked at that could be made illegal to vape in a car?
Just to reply to you, Councillor Stewart, the Associate Minister of Health, Minister Jenny Salesa, has proposed legislation, and it's coming up. We're expecting it to come up in mid this year, and she's proposing that, certainly including vaping in that. That will have to go through, of course, the submission process, but that is her intention at this stage. We'd love council support when it comes up for submissions, though.
Okay. So we got Councillor Darby's happy to move the thanks. Seconded Councillor Casey. Yes, sure.
I'm wondering, there's a suggestion that we're still writing leases without the smoke-free requirement. Can we just get a brief memo out checking on that? I think it's pretty fundamental.
Got a developing list of follow-up issues from this.
Can I just clarify just 2 seconds? We understand that new leases are having smoke-free clauses, so that's fantastic, but it's not going into necessarily automatically into lease renewals, and they're for long periods, well after Auckland Council Smoke-Free 2025 goal.
Happy to follow that up. Councillor
Thank you, Madam Chair. I was just going to add a point to Councillor Darby's comment. There's actually a number of things that the Cancer Society have identified that haven't been implemented in the council implementation plan. So if we're going to have a memo about the leases, then we're going to need a memo about all the other things that aren't being implemented by our council implementation plan.
Yeah, and I just note we've got all our staff here who will also be taking notes. I'll put the recommendation. All those in favour, please say aye. Against? Carried.